Ay, salamat.
Okay, sa mga basic lang ha. In a second, I'm just replying to the ER.
Yan naman. Tapos,
Okay. Now this is an algorithm. It's a very long algorithm, hexagons, but I'm just dividing it. Okay. So an adult patient with seizure. So please take note of this. Everything begins with the history, the physical exam. Exclude all of the mimickers, particularly syncope, TIA, migraine, and psychosis. So you ask yourself, is this the first onset or not? Is it the first onset of seizures? Does the patient have history of epilepsy? Okay. Does the patient have history of epilepsy? Okay. Please take note of that.
ano itiyak?
Now here, medyo busy slide. Busy slide. So if the patient has no history of epilepsy, what you do? Oh, my son will. So share the slides. Okay, let me go back to the previous slide. Here, do you see the slides now? Okay, see the slides now. So getting back to history. Okay, so history and physical exam is very important. You have to exclude the mimickers of seizure. So is there syncope? Is there TIAs? Is it stroke? The next thing you're gonna ask if this is first onset or not, or is there a history of epilepsy or a history of seizures in the past? If the patient has history of seizures, you must ask, are they taking any anti-seizure meds or anti-epileptics? Okay. So if the patient has history of anti-epileptics, always check what is the compliance or the adequacy, okay, of their uh, anti-seizure meds. So with history, no history, we're still gonna get electrolytes. Okay, you're supposed to get. Okay, don't forget the electrolytes. The blood sugar is very important. Hyper and hypoglycemia. Hyper and hypoglycemia can present with hypo and hyperglycemia can present with seizures. Okay. Then talk screen is not so readily available, but it's part of your workup. Okay. Now next, you're going to start and get the MRI. Take note that MRI is ideal, but if it's not available in your facility, then a CT scan would do. Okay. And of course, you're going to start your anticonvulsants, which is what we're going to end up with. Now, we only think of the lumbar tap if we're thinking infection, if we are thinking infection. So here, if you do lumbar tap, then you're going to think infection. You have to remember the lumbar tap is supposed to be done before the antibiotics is started, and a CT scan should be done. At least a CT scan should be done before a lumbar tap. Okay? If there are signs of increased ICP, such as increased sensorial, cranial nerve deficits, papilledema, posturing, decorticate, decerebrate, do not do the lumbar tap. Your patient might herniate. Now we're supposed to choose the right anti-epileptic drug. It depends on efficacy, okay, safety and tolerability. Okay, so it has to consider the following points: which anticonvulsant is efficacious, which anticonvulsant is safe, which anticonvulsant is tolerable. Okay, so please take note of that. So our goal is to balance between the side effects and the good seizure control. Okay, so you have to know the adverse effects of your drugs, the history of allergies. Take note that most of your anticonvulsants can cause drowsiness. Also take note that you have to get your liver function test for practically all your anticonvulsant except for one anticonvulsant, which anticonvulsant is basically almost renal. Which anticonvulsant? Which anticonvulsant is basically renal in elimination? Okay, so which anticonvulsant is basically renal? Okay, it's levetiracetam. Okay, now for the liver function, you have to get the SGPT, particularly in patients with phenytoin and valproate and phenobarb. For the drug interactions, the one with the safest profile is still levetiracetam, least drug interactions. But in patients with renal disease, you have to adjust the dose of levetiracetam. Okay, I'm gonna share this with you. You can actually, I'll give you a copy of this. So adults with partial onset seizures, number one, what you answer in the exam is carbamazepine. Okay, answer carbamazepine. Okay, so please take note of that. Okay, answer carbamazepine. Okay, please take note of that. Carbamazepine, level A, first line. Next, children with partial onset, it's oxcarbazepine. Okay. Now, I would just like to highlight, that be careful in carbamazepine, particularly Stevens-Johnson syndrome. Okay. We'll skip this. We'll use this one. Okay, for examinations, please follow this. This is lifted from your Harrison's. Okay, for GPC, generalized onset tonic-clonic seizures, GPC. So we have first line, this is lamotrigine and valproate. Okay, for GTC, for focal, it's lamotrigine and carbamazepine. Okay, for absence, this is for examination purposes. Always remember your first line here. What is your first line for typical absence? Is it valproate or ethosuximide? First line. Okay. First line is ethosuximide for examinations. Ethosuximide. Please take note of this. Okay. Now, just some tips. We give diazepam 5 milligrams. We're allowed to give at least 5. No, not 5, but 3 doses of diazepam. Then you should start already with your anticonvulsant of choice, depending on what is the seizure type. Okay, please take note of that. Now let me quickly mention the acute MI. Okay, which I'll play Dr. Pinky's video on the pediatric